Brazil, the biggest country in Latin America, has been hugely affected by the coronavirus pandemic. The healthcare system here is so close to collapse that they have been converting football stadiums into temporary hospitals. Inside this one in São Paulo, there are more than 200 beds for patients with COVID-19. As for lockdowns, cities and local authorities have been putting them in place themselves. But the country's president, Jair Bolsonaro, is against the idea of a national shutdown. He says he's worried about the economic impact of such measures.
Ecuador is at the moment the Latin American country hardest hit by the coronavirus outbreak. Thousands of people have died in the province of Guayas because of the virus and because of other conditions that couldn't be treated when the health system collapsed. Mortuaries and morgues were also overwhelmed, and bodies had to wait for days to be collected and buried. A nightmare no one wants to see replicated in other countries of the region.
Many economies in Latin America are already weak, and Venezuela is the weakest of them all. It's been in a deep economic crisis for years. Here, while there are not that many official deaths, the healthcare system is one of the most stretched and badly prepared in the region. Medical centers like this one are trying to get ready for COVID-19, but doctors I spoke with say that there are nowhere near enough intensive care units if the virus spreads. The government has put in place a shutdown, but many are worried that it could be a crisis on top of another crisis for Venezuela.
In many of these countries, most people live from the informal economy. They buy and sell goods for cash every single day. This street in Colombia's capital, Bogotá, normally is full of street vendors, people who are selling things from empanadas to cell phone cases. But the lockdown has practically freezed the informal economy, and these people have no source of income. But authorities say that the lockdown is the only way to avoid the health system's collapse.
But not in all the parts of Latin America has it been closed. Here in Nicaragua, people continue with daily life. The government has ignored messages from public health experts. Markets and shops are still open, and sporting events like baseball are still going on. The government says the economic cost of the shutdown will be too much. But experts are warning that if the country doesn't take action now, it could see an uncontrolled spread of the virus, and it could end in disaster.